Today, I want to continue the edema in addition with the previous class. I want to discuss between the pitting edema and non-pitting edema. Many examiners will ask you, and what are the examples of pitting and non-pitting edema. So, first you know what is pitting edema and non-pitting edema. So, characterized by swelling due to accumulation of excess fluid in the tissues and affect any soft tissues, both classified as peripheral edema, typically affects the legs and hands, arms. What is pitting edema? When pressure is applied to the skin of pitting edema, an indentation appears in the affected area. So, the most common causes of pitting edema are congestive cardiac failure, venous insufficiency and nephrotic syndromes. On the other hand, non-pitting edema forms to touch and does not form indentations of the edematous sites. So, excess fluid accumulation. So, in brief we can say excess fluid accumulation in the interstitial compartment causing swelling, especially gravity dependent area like the feet and ankles. So, it may be the generalized or localized edema. Interstitial fluid retention within normal lymphatic drainage. With appropriate pressure, fluid drains out of the receiving pressure side into the surrounding interstitium, forming a visible indentations in the skin when pressure is released. So, it is a pitting edema. What happened in the non-pitting edema, as for example, is lymph edema, myxedema. These are non-pitting edema. What happened? Lymph nodes are obstructed, altered or absent, otherwise dysfunctionals. Why? Due to surgery, due to infections, due to tumor formations. So, the increased interstitial fluid held in the lymphatic channels. So, there is no pitting effects. So, it is called the non-pitting edema occurs in lymph edema. What happened in myxedema? The subdermal interstitial fluid is rich in non-fluid substances, as for example, the mucopolysaccharides, hyaluronic acids, mucins. So, the interstitial oncotic pressure draws more fluid in the interstitium, and fluid are highly viscous. So, the drainage through the lymphatics is reduced. So, ultimately result the increased interstitial fluid retention with the reduced lymphatic drainage, leading to non-pitting edema, that is application of pressure, fluid pushing along the lymphatic vessels and returned as soon as the pressure is released, leading to non-pitting edema. So, you will be asked what are the causes of pitting edema? Cardiac cause, renal cause, liver cause, and in the early stages of filariasis, but in the late stage of filariasis is a non-pitting edema, and it also occurs in the calcium channel blockers. We are going to gist the pitting versus non-pitting edema So, the one point is indentation left in the skin. And non-pitting edema example is the lymph edema, pretibial max edema, especially the hypothyroidism, and pitting edema occurs in heart failure, chronic liver disease, chronic kidney disease, and in case of local varicose vein and thrombophlebitis. If you see the picture here, the edematous part does not pit on the pressures. Just you see the pictures. This is because the edema fluid is united with the tissue elements, occurs in case of lymphatic edema. Thank you to you all.